We have a fantastic panel here of ecosystem enablers in food and agriculture and health, and also nonprofit profit models and for-profit models, and in all sorts of different value chains. So really excited to bring this conversation together. And when we were discussing about this topic, really one key question that came out was, why is there a need for innovation? Right? Inclusive business models already sound rational, why not? But really what came out was that there is a fundamental misalignment or perception of misalignment between who pays and who benefits. And I think we all struggle with making that work and finding creative ways to bring those two parts together. So without further ado, I would love for everyone to introduce what they do and how it's related to inclusive business especially, and the models that you are using. So let's start with Claire from Producers Direct.
Hi, good afternoon, everyone, and thanks so much for this opportunity. Hopefully the dessert won't desert our energy levels from this afternoon. So yes, I'm Claire Rhodes. I'm the CEO and founder of Producers Direct. Producers Direct is a not-for-profit, and we were established in 2009. And we combine digital innovation with in-person farmer-led approaches, with a focus on enhancing the incomes, resilience, and power of smallholder farmers. And the way that we do that is we work through a network of smallholder-owned cooperatives across Latin America and East Africa. And through that model, our work to date has benefited over 1 million smallholder farmers. We're an NGO, but we also have a track record in incubating and spinning off social enterprises. So just one example of that, which is both from a personal and professional perspective, a success, but also a fail. So Producers Direct, we incubated a social enterprise called WeFarm, which some of you may know. WeFarm was designed by farmers, and it was set up to be a model where farmers could share knowledge and information with each other by SMS. Initially, as a kind of NGO-funded project, we had challenges getting money for it. So we spun it off. And for many years, it scaled and was very successful, including securing Series A VC funding. And so then, at that point, it was a success story, right? It reached 3 million farmers across East Africa. Check. And then, due to investor pressure, the business model pivoted. It was not able to raise the next round, and the business unfortunately closed a couple of years ago. With all of those 3 million farmers actually, what then for those 3 million farmers that were benefiting from that service? So, as CEO of Producers Direct and a non-for-profit, I sit here thinking about, okay, what does success and failure look like as we seek to scale our next business model? The model that I wanted to talk to you about today is one that we're starting to incubate now with support from the Bayer Foundation and also the WFP Innovation Accelerator called Farm Direct. Farm Direct is a digital cooperative designed with and for female smallholder farmers that digitally replicates the key benefits of a traditional farming cooperative. As we've talked about this morning, despite the fact that female smallholder farmers represent 50% of the world's 1 billion farmers, they're still incredibly marginalized from value chains, both for food and organized commodities. And we're looking to readdress that balance with Farm Direct. So Farm Direct enables female farmers to essentially aggregate their produce and sell it efficiently and collectively. So really looking at how the benefits of aggregation can be replicated through digital models. And so crucially, we've been testing Farm Direct with female farmers based on their realities, which may be a smartphone, but it also may be a non-smartphone or even pen and paper. And so what does a business model look like for those female farmers and for Farm Direct? And that's the challenge we're facing now. Currently, Farm Direct is supporting 3,000 female farmers to sell their produce, and it's scaled to about just under 1 million in turnover. And now we're targeting to scale and reach 10,000 farmers by the end of the year. And so what does it mean for designing a business model that's both inclusive and innovative? Well, firstly, we're putting really high emphasis on farmer-centered design with female farmers. Female farmers aren't typically involved in the majority of digital products that are designed to benefit them. And a quote from IDEO.org, a human-centered design organization: "If you're not designing explicitly for women, you're designing for men. And so this is important to us. Secondly, data. So typically, the economic activities of female farmers remain largely undocumented. And so what does the data model look like? So through Farm Direct, we're digitizing transaction records for these female farmers, enabling them to then build a credit history, which can be leveraged to open up access to other services, such as financial services. And I think for us, crucially, a third really key component of the business model is ownership. So for Farm Direct to genuinely be a digital cooperative, female smallholder farmers need to have ownership of the business model. And that is a challenge for then raising investment to scale that. So we're looking at how Web3 technologies can enable innovation and ownership models that ultimately enable the farmers not only to capture value because they're selling their prices for more, but also because they actually have ownership of the business model itself. And so excited to think about what innovation in the business model space looks like with you all over the next few days. And definitely welcoming partnerships and opportunities for collaboration as we scale this together. Thank you.
Thank you, Claire. I mean, definitely we heard some of the keywords, aggregation and data, right, engaging with smallholder farmers. Next, we have George from the WFP Innovation Accelerator.
Thank you, Tiffany. It's a pleasure to be here. Thanks, Andrea, for the invitation. We are the largest humanitarian agency tackling food insecurity. And why is that important is that unfortunately we still have 300 million plus people that are acute food insecure in the world today. These are pre-COVID levels, but unfortunately the funding is no longer at that level. So there is a tremendous gap in terms of the funding and resources available for humanitarian work. So we need innovation to actually bridge that gap. And that is achieved through a multitude of opportunities, working with startups like Farm Direct, Bumitra that uses satellite imagery and AI to look at moisture and carbon in the soil, enhancing fertility, but also revenue generation for the smallholder farmers, or working on partnerships like we have the Farm to Market Alliance, which is also in collaboration with Bayer and other agri-oriented businesses, so that together as a value chain, including public and private entities, we can actually offer the services that farmers need, especially starting with knowledge, access to the inputs that they need, access to finance and so on, that they can actually invest in themselves and scale their own business. Farmers are very entrepreneurial people. But also, what are we doing ourselves in terms of inclusive business models so that we can move beyond traditional grant funding? And that's why we have been investing a lot in innovative finance mechanisms that we say, how can we attract capital of different sources with different expectations, and therefore we can fulfill the criteria of those funders that are no longer just donors, but they are willing to pay and invest for the outcomes that we can generate. At the Innovation Accelerator, but WFP in general, we're looking at a multitude of solutions along this continuum. Working with startups, absolutely key, because they bring the disruption. They are the ones that, if they apply human-centered design, as Claire just said, they really bring the solutions with and for the communities. But also we need the partnerships and the funding to scale them, because what is true in one context, it is not easily replicable in others. So how can we leverage our, to a certain degree, footprint to help with that, our convening power to help with that, and ultimately innovative finance mechanisms, because what is valid to invest in early stage won't be true in middle, growth, and definitely not mature stage. So how do we build a continuum of products with different partners along that journey so that we can help startups to go from the idea to that impact of scale? And then they become, for us, vendors, ultimately at the end of the day, because our procurement is a great way to help these startups scale over time as well. So I'll be happy to talk about that. Maybe back to you.
Yes, definitely. In terms of building that continuum, you really need an ecosystem perspective to be able to fill in those missing gaps, right? So very appreciative of your work. Next, we have Joost from Healthy Entrepreneurs.
We have been talking about agriculture. Now, I would like to bring you to the healthcare part. And we have learned today it goes hand in hand, so that's positive. 1978, Alma Ata, we took a decision. We need to have a health system with a pyramid. The lowest level, community health workers, primary healthcare, district health center, or district hospital, referral hospital. By then there were 500 million people living on the African continent. Today, 1.3 million. By 2030, 1.7 billion people, I'm sorry. And so the model of actually having the different stages for actually access to universal healthcare actually makes sense. But we have forgotten one solution. How to deploy a network of more than 2.5 million community health workers on the continent. And deployment means actually training. It means monitoring. It means refresher courses. It means access to a supply chain. It means incentives. And so if you think about what is the cost for a national government or even for the whole continent to have actually a functioning community health system, believe me, it's a broken system. It's bankrupt because it's not affordable if we are just waiting for third-party donors, taxpayers, Western world to pay. So Healthy Entrepreneurs has designed, over time, an inclusive business model that actually responds to a global challenge. And I think the pandemic of COVID has been very clear to really offer a clear importance of the community health system. But even without a pandemic that actually affects the Western world, still children dying of diarrhea, children dying of actually malnutrition, there is a need for hundreds of millions of people to have access to proper community health workers. So our business model is actually an investment opportunity where we are actually supporting the marginalized populations to actually use their out-of-pocket expenses actually in the most efficient way. We are able to bring products and services delivered through trained and qualified and supplied community health workers at the doorstep. And so we are able to offer services of a good quality at up to 60% lower cost delivered at the doorstep, whereas actually healthcare becomes accessible, whereas actually healthcare becomes affordable, where we are actually bringing down the cost for a rural family from 15% of the monthly expenditure to 6% of the monthly expenditure, which actually complies with the universal health coverage ambitions. It's a model that actually is based on a backbone that is called a supply chain. Traditional business, where we are buying and selling products. And actually the community health worker trained is actually also buying and selling products and delivering them in a community. And we as healthy entrepreneurs make sure the supply chain is running, the quality assurance of the products is guaranteed, the assortment matches the national guidelines, and we are able to actually provide access to credit as a precondition to further expand the activities of the community health workers. Majority is female, and the future is going to be probably women only, although it partly depends on the national cohort of community health workers we are working with. But the model is inclusive, it's financially sustainable, and actually it's our ambition to have between 250 to 400,000 community health workers onboarded. And in preparation of this meeting, we were asked what is our biggest challenge. And actually it's our challenge that actually as a system changer, we are going step by step, making more and more governments to accept that actually there is an alternative way to actually use the non-tax paying population, asking them to pay out of pocket for some services at the lowest price possible, and therefore actually diverting and financing the majority of the community health system. That's what Healthy Entrepreneurs does. Thank you.
It's amazing. Changing the ecosystem, that's about the innovation, right? And for myself, from Alloy, our operations are based in Nepal, and we are a growth financing platform using financial technology to bring communities together so that we can help them access financing from large lenders. And our technology, what it does is it's able to monitor how the loans are going out. So for example, we work in the dairy sector and we work in agriculture and electric vehicles. In dairy, a dairy loan sent to a dairy farmer with our technology can only be used at the related dairy vendors. That means the loan cannot be misused and it's tracked completely. So there is a big problem when lending to informal sector entrepreneurs, which is why a lot of banks and commercial lenders do not want to lend to them. It's because they don't know where that capital is going. And without the proper records, without credit history, without collateral, they cannot have these traditional means of trusting these entrepreneurs and understanding that they will actually invest in their business and repay their loans, right? So instead of using this traditional model of credit histories and collateral, we are using micro actions, tracking these micro actions to be able to lend. So our software not only tracks how the loan is being used and how it can be making sure that it's going to the aligned purposes of that loan, it can also track how the repayment is happening through connection to buyers. So in the dairy example, we also work with dairy buyers that are buying from the farmers every day. And now by tracking and digitizing that payment, it means we can generate an income statement of that farmer directly every day. And from that, the lending can happen. And also the repayment can happen because they are selling that milk every day. It means that they can capture the repayment every day also from that system. So fundamentally, we're a software platform that helps lenders to be able to track their loans whenever it used to be cash. Now it's through our digital system so that we can generate all of this data from the micro actions and aggregate that and using the data so that we can lend more. And aggregation is another keyword that was brought up earlier because traditional lenders do not want to lend to one farmer for one small loan, right? It's just too much paperwork, too much operational cost, too much monitoring. So using our software, we're able to bring, let's say, 50 dairy farmers at once, each with a $1,000 loan. And now it's a $50,000 loan for the lender so that they can use our software to monitor it directly, knowing exactly where it goes and having a prediction of how it will be repaid. And so we have built this software for the loan side initially, and then we have also expanded it to creating wallets for healthcare, for example, or for education. So instead of having commercial vendors on the ecosystem that we can build, we can customize the ecosystem to be only the pharmacies, only the clinics, only the hospitals in an area. So when we create this wallet specific to each farmer, they can take that spending and go and spend there, but nowhere else. Meaning you know that that cost is going to healthcare and has that impact, but you don't have to restrict what people are using it for and when they are using it for. So you give that flexibility and the monitoring. And that's actually fundamentally how we look at our inclusive business model. It's really finding the flexibility between what is required in traditional requirements in terms of monitoring, in terms of operations, in terms of standard histories and credit that we have, and then also finding the flexibility that gives the power to the entrepreneurs to buy what they need for their businesses, to buy what they need at when they need it, where they need it from vendors that they trust. So we have built this technology and also open to collaboration in any sector and value chain to be able to have this B2B software being used to monitor the growth and scale of organizations. So thank you very much. And now we're moving on to the second part of the discussion, which is when we were discussing this, we found there's really a tension sometimes, right? And conflicting perspectives within this ecosystem. So we asked everyone to brainstorm what they think the biggest tension within this inclusive business innovation ecosystem is, and perhaps what can be done to address it. So I'll start with Claire again.
Thank you. Well, I had a long list, but I'm going to focus on three. So one that came up in the finance discussion this morning is the tension between reach in farmer number or total number of beneficiaries and depth of impact, and how you balance those two things. We have a live example of that with Farm Direct at the moment, because we're trying to look at how you balance engaging more women to be able to sell through the platform, and then being able to generate sufficient demand for the produce that they have in order to scale both the farmer number on the platform and actually the benefit per female farmer who's selling. So that's one. Secondly, I think, could anyone here articulate what a business model for a systems approach might be? I think that's a tension. We talk a lot about the importance of collaboration, but actually, what is the business model for that? I think one of the things that we find from a non-profit perspective is that we love working with startups particularly and other kind of for-profit entities, but we do run into challenges when there's issues around proprietary technology, data sharing. So what is the business model for collaboration versus competition? And then I think the third aspect, which we see a lot in Producers Direct, is tensions around the ownership model. We would love to work with partners who are excited about developing collaborative ownership models, and credit to the Bayer Foundation that they are. But At the same time, we've spoken to a lot of potential investors that immediately are horrified by that if they look at a cap table where farmers or cooperatives have ownership on the cap table. So actually, I think there's a tension around what a traditional investor might see as a blueprint for an investable business, and then co-ownership models. So those are the three that I found.
Absolutely. Going on to George.
I can continue, and I'll focus primarily on two things: access to expertise and access to capital, as both elements to drive growth. After that initial validation phase, where it's easier to get funding, especially if it is grant-based territory, often impact investors, and that's our experience where we try to bring our portfolio. You're part of it. We had Sanko in the morning, which is part of it. Collectively, our portfolio has reached 70 million people last year, has mobilized more than 200 million in investing between grant and equity investments. So to a certain degree, it is a de-risk portfolio. Not everything is investable, though. The majority is not. But what we do is try to continue to provide access to technical assistance through ourselves, especially people in the field that are really that local expert at the community level, that understand relationships with local governments, with local stakeholders, etc. But also, we try to create a continuum of access to capital, leveraging our ability to mobilize grant funding, and now, thanks to partnerships that we're establishing, in particular the one with United Nations Capital Development Fund, which is a sister agency that has an investment mandate that we lack, is very much looking at instruments to provide access to concessional loans and guarantees, concessional capital that is really concessional in fragile states environment. It's not impact investing in Europe to decarbonize, is looking at how do we address food insecurity or what we call urban poors in the slums of Latin America. It's very different, or addressing food security related ventures in sub-Saharan Africa, where there is a compounding risk effect. So access to capital in this context is particularly different if you want to grow your business into self-sufficiency. So what we're trying to do is create really that bridge to address that missing middle piece. We talked about it also in the morning, where we mobilize, thanks to our ability to convene partners, the capital that we can then hopefully deploy at more concessional loans, rates and guarantees level, that we can be additional to local players and not replace them, because we don't want to replace local players. We want to incentivize that they can actually participate, bring them closer to the ventures and so on. So I think these two are key elements, because the ideas are there, but to which degree are they investable? Often people say that they are investing in much later than they actually say they are. And our reality is that we need to continue supporting some of these ventures a bit longer, and we are creating the mechanisms for it in some cases. In our case, more focus on food security, but others are helping also in the context of health.
Absolutely. And you?
Well, thank you very much, because this is very interesting. As a social enterprise, we are dealing with government structures. We are dealing with actually investors that are traditionally investing in governmental or NGO-funded projects, whereas still there is a lot of logic, traditional thinking about how we have been funding programs. And I think the World Food Programme is a very good example that has been traditionally known for donations and actually securing lives of people. And so you are facing, as we are facing, a challenge that actually at ministerial levels, but also traditional donors and also people who are actually receiving money are still thinking in actually money coming in, distributing the money, and not even being forced to report on results. And we need to change that ecosystem, because the money available is actually only reducing. Correct. So we need to actually invest our money more efficiently. And at the same time, we are used to, and we are facing a cohort of traditional thinkers, or actually people with the wrong interest, that actually they depend on the traditional donor flows of money. And if you think about community health, where we are operating in, we realize that traditional thinking is actually probably our biggest barrier to actually get in. And I'm very glad to hear from you that you are innovating within the World Food Programme to actually make changes also from within the organization, because we are on the outside actually fighting In fact, we are offering currently our services to World Food Programme Burundi, so we should talk later. But it is actually setting the example at certain scale. And that's where we are coming in, and we are building the evidence case. We are building the case in Uganda at certain large scale. We were able to replicate our model. And so we have now, after more than 10 years, governments trying to understand, pushed by USAID leadership that actually says entrepreneurship is key, pushed by actually governments that are dedicated to change community health systems because they know they're not delivering according to what is expected. But it's a process, and it's a process that's extremely frustrating. Michael, I'm very impatient, you know, and I have to be very quiet because I see how we can do it, but it takes time. But we need to do that together, and this is actually building that system change, and we have to do it together. So I'm glad that we are sitting next to each other and showing and setting the examples that we can grow. Thank you.
Definitely agree with you in terms of the traditional views are actually what we're battling with the most, right? In our case, what we think the biggest tension is mistrust, partly stemming from this traditional view. What we see is because we're a platform that is a software that is linking informal sector entrepreneurs with the lenders, and actually between the lenders that they're also linking to larger global systems of DFIs, inclusive finance, and climate and green investments, right, that are coming in and trying to reach these micro-entrepreneurs at the very last mile. But there's multiple disconnects there. And that we see is because of this mistrust of how we can get informal sector entrepreneurs included into a formal system. So for us, seeing this mistrust and seeing how if we were to align everyone and have transparency within the whole investment value chain, we need to have technology and we need to have data to bring that mistrust using concrete examples and concrete data to be able to show how that can work. And to change traditional perceptions, we have to bring that in and then show the cases and then show the outcomes before you can actually change. And for us, really happy to report when we first started talking about productive loans, helping informal sector entrepreneurs 5 years ago with commercial banks in Nepal, nobody was interested. Nobody wanted to work with informal sector entrepreneurs. Why would you risk that and lend, right? And potentially bring that into your balance sheet. But then now, actually, the banks are coming back to us and saying, oh, we want to lend out and we want productive loans. We want to invest so that we generate local employment and we generate local jobs, and that there is a multiplier effect from that. And I think this global change in conversation comes from DFIs and comes from this global demand to make sure investment is spent well. Not every dollar invested is equal, as we heard this morning. Some definitely have a lot more impact than others. And how do we ensure that impact is really translated all the way down to that value chain? So this trust misalignment for us is a major tension that we can all work together in minimizing. Yeah, and we have some last minute for questions, if anybody has any questions for anyone on the panel. If not, we can also have some wrap up. So does anyone have any burning questions they'd like to ask? No? Well, if not, then, definitely, Stefan. Mike, please.
There's a barbecue tonight.
In Burundi.
It starts with a B, Berlin, Burundi. No, but seriously, just as a side comment, just listening to how Joost introduced the whole subject matter, again, there's an overlap and there's an immediate, intimate connection between healthcare, the access aspect, and that tension that you were all talking about. And I think a lot of people in the room have the same issue. So maybe, we should think about making a case study out of that because it goes across geographies, it goes across sectors, and it always has to do with the people at the last mile. And those are the ones that we're here for. So I would suggest elaborating a little bit more on that because I know how you prepared the session. So I think the result is worth being documented. Thanks.
Yeah. Definitely.
Well, honestly, there is not only here a collaboration, but we have also decided to marry. We are on the same table already. There's a lot of opportunity because exactly as what you say, we see banks in Uganda are pulling back away from remote areas. And so we need a platform that actually we are able to, in a controlled way, offer access to credit, because in the end it's all about credit, it's about financing, and then of course the right terms.
Yeah.
That's of course the second part, but we need to have that infrastructure. Whether it's health, whether it's agri, it's the same.
Yeah, at the end, it's investing in people, right, and giving them the safety nets that either insurance or access to finance give, so that they can do their own business and take care of their families. Everybody aspires to a better life, and smallholder farmers are no different. But also we sound big, but we have a tremendous funding gap. We have more than 60% funding gap versus the needs that we register. So colleagues of mine at the front line are daily deciding who they feed and who they don't, who they help and who they don't. And the line from our perspective here is so thin that we wouldn't be able to tell the difference why this one person gets and the other one not. So also for us, we're doing a lot in terms of innovative finance, on trying to find different ways, be that helping governments with debt swap mechanisms, leveraging climate finance mechanisms, blended finance structures and so on, because we need to mobilize funding from other sources. As you said, traditional donors are getting less and less appetite to invest in emergency crisis because they're just more and more and more with domestic problems on top. So how do we create investable propositions that allow us to attract different types of capital is part of the game. And that's where we can collaborate in coming together, and we can take some of that early stage risk on to help validate, demonstrate the evidence that then others can pick on and then take it to further scale. And that's exactly how we can work together as an ecosystem to address these very fundamental issues that unfortunately still affect millions and millions of people in the world.
Yeah, definitely de-risking and collaboration within the ecosystem. I think that's partly what we found also in terms of technology. We're all building very much in silos sometimes. Like we need some technology, we need it to scale. But what are the B2B solutions out there, right? What is out there that different social enterprises can actually collaborate? And I think that ecosystem perspective, a funder perspective, definitely can bring a lot of that cross-pollination together. And we look forward to that. And that's why these days are amazing. I have already made so many contacts with Just also about how we can scale together.
And so, guys, this is what Bayer does. So please don't forget. It's so important to be here together, to have these conversations and to continue thinking. And Stefan, what you said, building a number of cases and actually showing larger, higher level, larger organizations, investors, what we can do. That's where we are actually working towards. And that's an ecosystem we are building. And I think this is the way forward. And the good news is that the world is changing around us and we are all together on the right track. So your suggestion to build those cases is highly appreciated, and where needed, I think we are all willing to support. Thank you.
Thank you.